Person-centered care has a long association with nursing. It can be defined as positioning the patient and the entirety of their needs at the focus of care, defining them not as their condition, but foremost as a whole person. Respecting their rights to self-determination and collaboration in their delivery of healthcare. The word holistic correlates with person-centeredness and can be defined as a comprehensive view which takes into account a patient's physical, emotional, social, spiritual, and psychological well-being. It can then be stated that person-centered care takes a holistic approach to nursing. This idea of delivering holistic focused care to patients respects their rights as well as building mutual trust, resulting in better therapeutic relationships between patients and healthcare workers. The overall goal of person-centered care is to increase patient satisfaction, which then correlates with improved health outcomes. Major emphasis is placed on person-centeredness throughout nursing training, so much so that it is referred to as the golden standard of nursing, which is why it is then reflected within policy, legislation, and professional codes of conduct throughout the profession. The World Health Organization states that integrated people-centered health services means putting the comprehensive needs of people and communities, not only disease, at the center of health systems and empowering people to have a more active role in their own health. As a group, we discussed that person-centered care means to us. We agreed with the literature and concluded that by recognizing, respecting, and then incorporating one's personal beliefs and values into their healthcare, optimal healing and recovery can be achieved. If you focus your attention to the slide, some of our combined core values are displayed. As student nurses, we believe that these 13 statements really encompass what it means to practice with person-centered care as the main focus. It is our view that with self-awareness of our own holistic state, effective training, and continued personal development, positive patient outcomes and satisfaction will be successfully achieved.
The leadership challenges for a nurse are identified by their beliefs and values, commitment of their job, as well as their interpersonal skills. Leadership has often been described as a performance of an individual whilst directing activities of a group towards a goal. Effective leadership can have a significant impact on staff, patients, and the organisation. Some cases, the leader will need to encourage staff members to influence decisions as well as initiate a change in underlying beliefs and values. The values and beliefs of a nurse can affect the leadership abilities and challenges as well as how they care for the patient, which may not be recognised immediately. Commitment is something that you're willing to give your time and energy into that you believe in, especially when the actions of a nurse can directly affect a person's life. You'll need to be dedicated. The role as a leader in nursing can include making supporting decisions to ensure the commitment to the patients is the first priority, which will also include striving to provide the best care and guidance for the patients. Being a nurse is not a job that is easy to take on. The person needs to be committed to the role to ensure that they will have the patient's best interests at heart. Developing interpersonal skills is a part of learning what type of nurse you are and the type of nurse you need to be. Essential skills for nurses may include communication, both written as well as verbal. The nurse is usually the person who reports back to the doctor, and the accuracy of the information being reported is important to determine the action needed to be followed and followed up care. Listening. Having the ability to listen to what the patient is saying is necessary. Patience. This can be tested by the patient or the patient's family, asking questions about the illness and demanding answers. In this case, the nurse will need to stay calm and be helpful in a way that they make sure that they answered all their questions appropriately and effectively. Also, sense of humour. Using humour within appropriate conversation can lighten up the situation not only for a nurse but for a patient or the patient's family as well.
The skills and capabilities of a registered nurse. To be a capable registered nurse in today's society, nurses must be registered with the Nursing and Midwifery Board of Australia to be able to practice legally within the Australian healthcare system. To become a registered nurse, nurses must demonstrate competencies in the provision of nursing care and patient safety. Nurses must adhere to the National Board of Standards, codes, and legislation in the context of nursing care. As a nurse, you are required to work as part of a multidisciplinary team, where teamwork and effective communication is imperative. These teams include nurses, doctors, and specialists who are working together towards a common goal of providing the highest possible level of care for the patient. As a competent registered nurse, nurses' knowledge must be up to date and relevant, with a lifelong commitment to learning. Effective communication is important for any capable RN, as nurses are responsible for relaying critical information from their patient to doctor, but also to the patient and their families. Effective communication is important for the patient to fully understand their diagnosis, medications, or any other health concerns they may have. Critical thinking skills are vital in nursing, as nurses must be able to assess a situation and make critical decisions on the spot. Capable nurses must be able to quickly and confidently find best outcome resolutions in high-pressure situations. Critical thinking is essential for analysing the situation and determining the best solution for that patient. Nurses must have a fine attention to detail to safeguard against medication errors and to do no harm. Nurses must apply active listening skills when a patient is describing their symptoms and ask the right questions when making an assessment. Nurses must document everything they do on a patient's chart and follow the 6 R's to safety, to medication safety. Failure to do so could be a fatal mistake. The main role of a registered nurse is health promotion. Nurses must work alongside communities, families, and individuals by using accurate information and education to help prevent illness and disease. Whilst a patient is in hospital, their nurse is their health advocate and is responsible for implementing interventions and the coordination of care between interdisciplinary teams. Nurses are required to perform comprehensive and accurate assessments on their patients, use critical thinking skills and evidence-based practice to plan, assess, and implement effective care. To be a nurse, you must be compassionate and always thinking about things from the patient's point of view, making people feel comfortable and providing emotional support while in hospital. Using a holistic care approach to achieve the best outcomes for the patient has been shown to contribute and improve the patient's outcome. But most importantly, as a nurse, you must develop a sense of self-reflection to better understand complex issues and concepts that may arise. By allowing self-reflection as a nurse, you can facilitate change in your behaviour as a nurse, but you can also help alleviate prejudice or bias by understanding the uniqueness of others.
The first nurse-led initiators and innovators in nursing practice began with our nursing theorists in 1854 with Florence Nightingale. Nightingale's nursing principles of care for the ill were implemented. In 1952, Hildegard Peplow analysed nursing actions using interpersonal theoretical framework, and in uncovering Abdella's theory, the work of Faye Abdella in 1960 theorised and emphasised the delivery of nursing care to the whole person. Nurse-led initiatives and innovations are not new concepts to the nursing profession, as nurses globally engage in these practices to deliver person-centred care. The first nurse-led initiative being discussed in this lecture is the very powerful and important care of the deceased patient and their family, encompassing compassion as a necessary element in end-of-life care. Compassion is described as having the capacity to bear witness to the sorrows and the beauty of the world. Nurses must have an increased awareness and the knowledge needed to participate in caring for the deceased patient, as this caring must encompass the use of sensitivity. Preparing the body for the family to view should be considered a mark of honour bestowed upon the nursing team. Nursing actions at this time have the potential to form an important part of the passing and of how the family may perceive the experience in the subsequent bereavement and grieving process. The sensitivity will direct the nurses into the realms of cultural, spiritual, and religious requirements during this solemn process. Cultural and religious observations may involve special rituals in which the nursing team will engage respectfully and in collaboration with the family and loved ones to maintain dignity and the respect for the deceased. Preparing their environment and removing all distractions is akin to cultural practice in the healthcare environment. Do not underestimate the impact the death of a patient may have on the nurse, as the longer the team have been caring for the patient, the stronger the emotional bond will be. In achieving person-centered care, a bedside handover of each patient is performed in the clinical space. Bedside handover is described as being an instrumental tool in visualizing the patient and to facilitate patient participation for the improvisation of establishing patient safety. It is extremely important as a nurse to ensure that we engaged in immaculate communication to provide and deliver our duty of care to each patient. Handover is also a tool used for the patients to have their say in their health continuum process.